how PROMs influenced care plans or clinical decision in your organization?
Thank you so much, and good morning, everyone. Actually, back to the original question.
Yeah, of course.
Have examples.
Yeah.
Okay, if we ask, it depends upon the stakeholders we are asking. For example, if we are asking provider executives or payers, with all due respect to my colleague from Antalya, they will say, even inside themselves, cost reduction comes first. Not CROMs, not PROMs, not PREMs. Yeah, it's real, and it's very true, and it depends upon the stakeholder point of view, and we respect that. When it comes to the patient, definitely the PROMs and the PREMs, my experience and my outcomes. If it comes to the physician, it's the CROMs. It matters to me. But I go back to Dr. Abbas. It's very interdependent, okay? But if we have to order them, it's the CROMs. For example, cataract Quest survey by Aisha. Okay, it's very heavily dependent on equipment and technical skills of the physician and optometrist to assess the patient. Patient has simple complaint, I have hazy field or whitening in my sight, but at the end of the day, CROMs comes first here. So this is the base of the pyramid. Yeah. And then PROMs, we are following up, even the physician will do the boarding for the patient, convince him or her with the importance and significance of going through with the PROMs, and it is very straightforward with the cataract, it's pre and after, if it is cataract surgery. So PROMs, then pre and post surgery. And PREMs, patient experience. But when it comes to the patient access to care, like pre-authorization rejection, for example, or some claim or partial claim denial or something, now it is not only patient experience, and I have to stress on this. It is not only patient experience when it comes to patient access to care, it is system experience, it is regulatory experience, it is payer experience, it's a provider experience. So it is not only a patient experience, not to underestimate the patient access to care.
Actually.
Definitely. Regarding the examples, if we look at the osteoarthritis grade 4, for example, the patient will go for TPR or total knee replacement. It is a very long path to measure the outcomes, like for 2 years. The studies show, okay, that after 1 year, after a marvelous, TKR procedure with a very well-known surgeon, actually, if the patient keeps the same BMI, same lifestyle, this patient will be a candidate for revision, which is a worse procedure for the patient. So outcomes, yes, it matters. Following up on the PROMs, it can come up with an experience, it can come up with a lot of things to physicians, it can improve the care, it can reduce the cost eventually. It can take one time. It's like longer breath, it is not shorter breath.
That's right. Actually, I remember that way, but we have to give them insight that your voices matter, your opinion. What do you think? Asking patients sometimes, what do you think? Give him a privilege to say, thank you for asking. And but I have a lot of questions, but just opening this window with patients will make them understand that there is something is happening, there is a change, transformation,